I'm going to get you to look inside like a pair of binoculars.
Michelle Boyce helps her patients see clearly, but fears she could go blind before Ontario's health insurance plan steps in.
This makes me feel very upset and sad and angry. I shouldn't have to fight for my vision. Everybody should get the same chance.
So I'm going to take a look at your cornea.
Boyce was recently diagnosed with a degenerative eye disease called keratoconus that could lead to blindness.
Put yourself in my shoes. If you could never see your family again, your spouse, your kids, the people that are important to you, how would you feel that the government doesn't see the importance to cover this surgery?
The only way the province will pay for corneal transplant surgery is if Boyce loses her sight. But another procedure called corneal collagen cross-linking could prevent that. It can slow down the disease significantly or even stop blindness altogether. It is covered in 6 other Canadian provinces and territories.
These are the last calculations.
Ontario has been studying if it should cover cross-linking since 2012. It even funded a pilot project.
It's of value to patients with this condition, and patients with this condition in Ontario should be offered this treatment.
The study found cross-linking can be effective, but a year later, the government is still reviewing it. In the meantime, the program is still available for some patients. There is a waiting period, and patients need to qualify.
Let's have a look at your eyes. Put your chin there.
The trouble is, not everyone knows the program exists. Even specialists like ophthalmologist Dr. Mohammed Taha.
I think it should be advertised more, and I haven't told the patient that there is a program because I didn't know about it, actually.
As for Boyce, she says she doesn't have time to wait and wants the procedure now.
Ontario government needs to step up. They need to wake up and see that this is not an elective surgery. This is something that needs to be done.
Ashley Burke, CBC News, Ottawa.
It is up to each province to decide what they will or won't cover. So it's pretty common that one patient has to pay thousands of dollars for the same medical care that another Canadian would have covered. Consider insulin pumps, which cost around $6,000 to $7,000. Some provinces pay for them. Some will only cover children or young adults, while other provinces will pay if you have a low income. Then there's the coverage or lack of for cancer drugs taken outside of hospital. In Western Canada, patients don't face the burden of paying for that medicine, but that's not the case in Ontario or the Atlantic provinces. Provincial pharmacare plans there don't cover that cost.